Dear learners and all the regional directors and the students who are attending this teleconference session, I welcome all of you. And today we have taken this topic on report writing and IT skills. This is from the BNSL 209 Practical Manual 2 Unit 3. As you know that since 2023 onwards, IGNOU has integrated the CCH logbook in post-basic B.Sc nursing program, and in that there are 20 skills which were mapped from the syllabus of certificate in community health, and it was found that these skills, if the students side by side take in the post-basic B.Sc nursing program also, so they will be having dual advantage of getting the degree as well as they will be considered for the post of community health officers also, those who will pass from 2023 onwards. So this is the third skill in the practical manual 2, report writing and IT skills. As you know that report writing is the most important component unless you have done some activity and you have not documented it properly, so it is of no use. So you are working heavily in the practical areas in the hospital as well as in the community setting, but if that work is not documented and you are not recording it properly, then work done is just half done. So this skill is very important for all of you. I will be discussing today the various components of report writing skills. So first of all, let us see the objectives of this unit. As you have to ensure the availability of all the registers to be maintained at the health center. If you know that what all registers you need, then only you will be able to make out that whether these registers are available or not. So you should have that knowledge. Then you appreciate the availability of all the equipments and the drugs in the working condition. If you have to do certain activities, you need equipments, you need registers, you need many other infrastructure, so that you have to ensure availability, even the drugs. Then you should be able to fill the records properly and prepare and send the reports to the authority for their needful action at the upper ends. So you need to prepare the reports. For that you need to know about the report writing, and you also need to identify any endemic or the outbreak of the disease and report immediately to the responsible authorities. So some of the diseases are notifiable diseases, and if you are able to notify them and report timely, then timely action can be taken. So these are the objectives of knowing this unit. And before you start, because when you are working in the community, you need to know the background of the community. You need to prepare a sort of map of the area where you are working. So you need to identify the village to be covered by the sub-center. As you know, at the first instance, at the remotest of the area where the sub-center is located, and nowadays these sub-centers are upgraded with the infrastructure, with the trained manpower, and now they are being called as Ayushman Arogya Mandir or health and wellness centers. So health and wellness center is in the village, and you take the help from the Anganwadi workers. You can take help from the trained birth attendants as well as the Mahila Sahyog Samitis members, etc. from each village, and prepare the map of the sub-center or the milestones what are there, so that it is easy for you to be familiar with the physiological or the geographical background of the sub-center. Then you identify the community resources available in the sub-center area, like the place for conducting the group meetings, where you can do the group meetings. It can be a public place or the private, then you need to have what kind of transport facilities are available, and which are needed for the referral, as well as the people who can help in organizing various camps, etc. So you can prepare the map and know the background. Now comes to the various formats or the registers which will be required to be present or available at the sub center, and you as a trained health worker has to ensure that these registers should be available. So first of all, you should have the village register. So what is this? The register, village register is maintained to store the information regarding an overall picture of each village covered under that sub-center, and the information needed to be recorded are the number of households. A household, what is a household? It is the consist of those family members having the common kitchen. So you can say a family can be a one household, because maybe in the family, if it is a nuclear family, there can be two parents and two children, or that can become a household. So number 4 family members in a particular maintaining common kitchen is one household. So you should know in your village and how many households are there and the total population of the village. Suppose there are 200 households, so maybe 1000 of population, and that you know that a village of having 1000 population can be considered as one village. Then village register also the population distribution according to the age as well as according to sex, then number of Anganwadi in that particular village and name of the Anganwadi worker you should know, number of the private practitioners, because every village or every place has some or the other private practitioner. It can be an allopathic, Ayurvedic, homeopathy, RMP, etc. And dais in each village, and if there is a dai, then name and address of that person. And schools, if any school is there, where is the school located. Village register should also have information about the Panchayat Bhavan, where is it is located and what is the address. Then you can have the Mahila Mandal members as well as the voluntary organization, if any, and number of deep hand pumps, etc. So that can be written in that village register. So this is the format of the village register. Now comes the household survey register. This is the second register you can maintain, that is household survey register. The information in this register you will maintain regarding each and every household. You can collect during the household survey. After the initial survey, it should be revised after every 3 years, because in a period of 3 years there can be many changes, and the details of the information need to be collected and entered in the survey register. Can be in the form of eligible couples, it can be information related to the pregnant mother in the households. You can record information about the pregnant mother register who are given full doses of TT or 1 dose of TT, so that you have to record in this. Then birth register, then home deliveries, if any taken place, home deliveries conducted by TBS or home deliveries conducted by the ANM or LHV, deliveries conducted at B.Sc or CSC or government hospital or nursing home. So these are the information you can collect in the household register. Also, because household is the main source where you can collect all this information, like deliveries conducted by private practitioner or any delivery conducted by any mother who was at high risk, you can record in this register. Then pregnant mothers who develop any kind of complications, abnormal deliveries, abortions, low birth weight babies born or newborns, baby who had difficulty in breathing immediately after birth, or the baby did not cry after birth. All this information you can record in this register. Then neonatal death, if any, occurred, any stillborn baby delivered, children up to 1 year of age, children below 3 years of age, and children who had frequent episodes of diarrhea. Also you have to make a record in this register. Any children referred due to dehydration, any number of children who had frequent attack of acute respiratory infections, you can record. Then it also need to record the children referred to PSC hospital for treatment of pneumonia, and children suffering from malnutrition, children going to Anganwadi centers, children completely or fully immunized 1 year up to 3 years or up to 5 years of age, as per the information collected in per household. Women using oral pills or women who have undergone MTP, women who got copper T inserted, couple using condom, women who had accepted sterilization like tubectomy for the female and vasectomy in case of men, and women who are having sign and symptoms of RTIs or STIs. You can record here. Women or couple taking any treatment for RTIs or STI, also you can record. So you will come to know how many women or people in the village having RTIs or sexually transmitted infections are, and out of them how many of them are on treatment. That you can get the data later on. Then adolescent, number of girls between 10 to 19 years of age, and number of boys in 10 to 19 years of age. Another register is the eligible couple register. So in this register you need to identify the number of couples who where the wife's age is between 15 to 45 years of age. In the household survey register there is a column for the eligible couple. So you should be very clear who is an eligible couple between the age of 15 to 45 years, and you address you write their address in this register, and the family status with the parity, and the age of the onset age of the youngest child should also be mentioned in the register. Then couple, if using any contraceptives, also need to be recorded along with the details of the contraceptive methods being used by the couple. So these are the information you will record down in the eligible couple register. Then there is cumulative family record. Cumulative family record is where you will collect the information or the data related to the particular family. Like if you see the table given in the slide, number of there you will write in general like the name of the head of the family, household, house number, family unique ID number, type of family, religion, caste, whether family is BPL or not, and the in the table you can mention the name of the family members. Each family member, as in one family member there may be 4 or 5 persons, so you will have to record for each and every family member their age and sex of each family member, relation with the head of the family. You can mention whether one is self, then wife, then children, or daughter or son. Then education of each of the family member, occupation, if there is children below 5 years of age or those who are school going, you can mention that student, and those who are not going to school, you can mention that they are occupation is nil because they are not doing anything. So income also you can ask the income of the family. If both the parents are working or one parent working, you can ask their name. Height you can record of the all the family members. Weight also you can take, and number of meals per day. In the villages sometime they use two major meals. One is in the morning, so that is called their breakfast plus lunch, and then they go out and work, and even in the evening they come back and take dinner only. So, and that is the trend. You can ask and note down whether it is same or it is they are taking in some other way. So any health problem to the family member, you can just ask in general, and in case of any problem, so that you have some idea. And this way, when you are recording all this information, meeting the family member, you develop rapport also with them, and they also come to know about yourself. And later on, if you develop a good rapport, so they also cooperate with you, and they try to utilize the facilities being provided by the government of India in the form of health and wellness centers in the villages, and these are very useful in providing them healthcare services. So there are number of things, because everything happens in the family only. So you can even record the data about the birth and death. Any number of birth or death have taken place in last 12 months. It is one or two, or what was the sex of that person who born or die, any death in last 12 months, etc. Then communication facilities available, from where they get the information. Are they a family member have a facility of getting newspaper, or they have telephone, there is a TV or radio available, and if there is any other, you can write down and specify. Then social pathology, you can ask about the habit of addiction, any divorced or widow or delinquent behavior in the family, or any unemployed member in the family. So all these social pathology can be asked. You can ask about the environment, like type of house, whether it is kacha or pakka, semi pakka, you can ask, and total living area per square meter you can estimate, and type of toilets, attached, semi-attached or detached, and electricity supply is there or not, and if it is there, then it is or you can ask about the ventilation. You can even observe some of the things, whether it is fully ventilated or not in the environment, ventilation is adequate or not adequate, lighting, whether if you are going in the daytime, then you can make out whether sunlight is proper coming or adequately or not. Then source of water supply, whether it is tap water, bore water, or any other. Then water storage, where they keeping safe water for drinking in the hygienic manner or not. Then waste is water drainage, whether sewerage is there or drain is there or not, any soak pit or open latrine. So you can write down in the space given as per the data you get. And then refuse, whether they have open field or in a municipal van is coming to collect the refuse, you can ask. Then sanitary latrine, whether it is available or not. Then if it is any animal or pet is there in the family, whether inside the pet is inside the house or outside they keep, or there is some area for the pet, or because there are many you get the risk factors also, whether family is at risk of catching the infection from the pets or not. If then any family planning information you can ask about the contraceptive method used in the family, like condom, OCPs, or the copper T, vasectomy, tubectomy, as I have done. And if any person is using, you can take the unique ID number of that eligible couple, then duration of use, since how they are using this particular method, are they satisfied or not satisfied with the method, can be recorded. Then another aspect which you can record is the maternal health and the contraceptive records, like in the maternal health, like antenatal record is very important, like unique ID number of the woman who is antenatal, name of the mother, husband name, residential address, age of the mother, LMP, EDD, then Mamta card or MCTS card, or any card is made by the family member, if it is a below poverty line or as per their suitability. Then gestational age of the at the time of registration, number of ANC visit if done, or they have to start, or whatsoever. Lab investigation if done, if it is done, then you can take down this information from the records also. You can ask them to show, like hemoglobin, urine albumin, urine sugar, blood grouping, etc. Then tetanus toxoid vaccine, first dose, second dose, and booster dose. So whichever is applicable to that particular antenatal mother, accordingly you will ask and record in the format. Then any disease during pregnancy, like anemia, hypertension, and any other, it can be gestational diabetes, mellitus, etc. So that you can ask. And over a period of time, because you will be doing the follow-up also, because you have now got the antenatal mother, so you can over a period of time monitor all these high risk pregnancy risk and do accordingly timely treatment. Then if any treatment taken by the antenatal mother, that also you can ask and write down. Then natal record, in case the mother is in the natal period, then you can ask about the place of delivery, whether the delivery has been conducted in the institutional area or at home. So you can ask. Then delivery conducted by the TBA or untrained TBA, or it is conducted by ANM, LHV, community health nurse, or doctor. So you can tick any of the thing who has done it. Then any complication during delivery, whether it has happened or not. So you can ask in the natal record. Then postnatal record, you can number of days in the hospital. So if the delivery was taken place in the hospital, how many days the woman was in the hospital, and when she was discharged from the hospital, and number of visit for the postnatal checkup, and any complication had happened or not. You can ask. And initially, whether the initiation of breastfeeding was done within 1 hour of the birth of the newborn baby, or it was delayed, or whether there was it successful to initiate breastfeeding within 1 hour. So these things are very important history from the point of view of the mother as well as the newborn baby. So if you come to know all these things, you can take some corrective measures by asking this question. Then contraception register, you can write down about the temporary method, in case female is using oral pills or IUDs, in case of male Nirodh or condom, and permanent method vasectomy or for male and tubectomy for female. Then child health register, this is another register in case you have a child under 5 years of age, then unique ID of the child, father's name, mother's name, residential address, that will be there. Then age, sex, date of birth, birth weight. It is very important to know the birth weight also, and you can make the mothers aware that they must know the birth weight if she is antenatal, and if she has to undergo another delivery, so you tell the importance of birth weight. Then place of birth, whether it was institutional or home, initiation of breastfeeding, exclusive breastfeeding till the age, till how many months baby was given exclusive breastfeeding, that you will have to ask the mother. And age of weaning, when they started with the weaning of this child, then immunization card you can ask to produce, and in that you can take down or record whether BCG was given at birth, or all these hepatitis birth doses of OPV, penta, whether it was given as penta 1, 2 or 3 as per the schedule, and measles vaccine was given at what age, and or immunized or not. Vitamin A started with the measles, and DPT as per the doses. So as per national immunization schedule, you can take from the record and write down here. Then, as you know, there is another register. So this we were discussing the family community family folder, which, because family consists of all mother and newborn and children under 5 years of age, and need birth or death, so all these are the part of the community family record. Now there is another record register, that is sub center, or because sub center is also called first referral clinic unit clinic register. So this register is maintained for keeping the record of the patients who attend the sub-center clinics. So the attendance in the antenatal mothers, attend the children who have come for immunization, family planning services, and should be recorded separately, but the sub-center register will have the record of the patients who are coming with some or the other health related problem, because antenatal and immunization are the routine activities which are having specified days, that this today is the immunization day, so whole immunization will be recorded there. But in case the patients are coming with the health problem, maybe some are coming with diabetes or hypertension, or patient may be coming with diarrheal diseases or some ARI, pneumonia. So that every patient who is coming with health problem will be recorded in the clinic register of the sub-center. So in which you can write down number 1 as per the serial, in which date, name and address of the person who has come with the health problem, and what were the chief complaints, with what complaint or health problem patient came, and did any medicine was given, and then you can write in the remarks whether you have satisfied the patient or patient needed further referral. So these kind of information you can give in the remarks. So with this we will take a short break of 2 minutes, and I will be back with the same topic. Thank you for listening.
In the digital revolution time, education is one of the priority. Online education is flexible, convenient, can be customized as per your needs. From filing application till the graduation, the entire teaching learning process can be completed through computer, through mobile, through laptop. IGNOU is offering various programs through online mode. One such program is MA in Journalism and Mass Communication. This program is offered through learning management system. You can customize, make it convenient as per your needs. And entire teaching learning process is being facilitated through 4 quadrants. The learning and teaching through text materials supported by audio video materials, and along with that there is a discussion forum to interact with the teachers and your classmates, and online assessment. And this is the standardized international standards for online education is being incorporated in emergency online program. It has the following focus area: news writing, news editing for newspaper and magazines, online journalism and broadcast journalism, media ethics and development communication, communication research, digital media, and various other aspects of communication process. The entire learning content of this particular program generated by renowned Indian academics. You will learn the nuances of communication with Indian examples. This particular program is 2 years in duration and it has 16 courses. After the 16 courses, 12 are theory and 4 are practical projects. If you are a techno-savvy and if you are able to control various technical tools, wants to learn more about media and communication system, then this is a program meant for you. Welcome to this program.
Dear learners, you all are welcome to this session after the break. We were discussing about the report writing and IT skills, which is taken from the Practical Manual 2 of BNSL 209, Practical Manual 2, Unit 3. And as you know that this has been integrated from the Certificate in Community Health program, and students will be getting benefited by adopting these 20 units and integration in post-basic B.Sc nursing, so that those learners who want to work in the community area later in life, they can work as community health officer depending upon the availability as well as their interest in the community. So we have discussed in the previous session about the various formats of village register and many other registers, cumulative family health records, etc., and what all information you will be collecting and recording in those formats, because this is just a data which has to be recorded and it should be reported to the higher health facilities or to the policy makers, so that a certain decisions can be taken as per the need of that particular village. So we have discussed about various other registers, and one of the registers which I was discussing was the sub-center or for FRU clinic register, in which you will record the number of patients who have attended the sub-center clinic and various aspects of that, in case you have given some medicine or the patient who was in need of some higher health facilities, you must be making referral. So all that information you can record in the remarks. There is another register, that is death register, and all the deaths occurring are in the area are covered under that sub-center are entered in this register, and the date of the death you will record, name and address of the person, age and sex, and the cause of the death you can record. Now comes the another register, that is the stock register. The stock register consists of the records of the particular particulars related to all the items provided and utilized at the sub-center. So what all in that items, one number of the most important thing in the sub-center will be the drugs. So the date, and you will write which date you are recording, previous balance of this particular drug, quantity which you have received, quantity which is utilized or used, and out of that what is the balance in hand. Now you have to maintain it on a daily basis, and also about that drug you will write the expiry date. And in the remarks you can again write the remarks whether it is to be utilized. If the expiry date is coming within a short period of duration, then you can write utilize it first. First you have to utilize this thing. In case of inventory of the vaccines and drugs, again you need to write the number of ORS packet received. Metronidazole is the tablet, cotrimoxazole tablet, paracetamol, chloroquine, any antiseptic solution you have received. Then heuristics, DD sticks like disposable delivery kits are also there. So how many you have received. In case you have thermometer, gloves, IFA, etc. Then iron folic acid tablets, then it can be for the adolescent as well as for the adults, so you have to record them separately. Then vitamin A solution, condoms, oral pills, IUDs, syringes and needles, all those you will be recording in the inventory register. And the requirement assessed last year, you have to see the what is the requirement which you was there in the last year, and the actual quantity received last year. So one thing is you have assessed the requirement, and other thing is the quantity received. Although your assessment is something, but what you received may be more or less, so that what is actual. Then surplus of shortage last year, in case any shortage were there, and requirement for the current year. So these are the details regarding the inventory of vaccines and the drugs that you can record. Then another record is there, the monthly stock position. What is the monthly stock position of the various items which are there, like iron folic acid tablet large, then iron folic acid tablet small, then vitamin A, again all those items which I have told before. In case you have got some injections also, like methyl gometrin or the antispasmodic tablets, that also mebendazole is there, syringes, needle, vaccines and vaccine day carriers, as well as sterilizer or the autoclaver. And in case of any item whichever is there, you have to record the opening balance, what has been received by you, and what is total, then what is consumed, what is the balance, and the what is the further requirement, etc., that you can mention. Then in case of any vaccine received or any antibiotic received, again you can antibiotic list that has to be included with along with any other drugs as per the government approval. Vaccine received from the P.Sc, because what all vaccines you received from the P.Sc, again you can mention DPT, OPV, DT, TT or BCG, measles and the pentavalent. So these are the vaccines usually you receive. So you will see the vaccines received for the weekly session, because every week there is a immunization session, or if you have 2 sessions per week, then again you have to mention there. Then vaccine received for weekly session, 3 day dose, 2 days date dose, या 3 days dose, dose, that separately you have to mention, and there are vaccines which received for weekly session or 4-day dose, etc. So that is specifically you will mention separately, and the vaccines received for the weekly, again you will mark, record separately, then vaccines received and their total of that you can do in that stock register. Then there is another register which is also very important, that is the register for the consultative process. As we were discussing that there are many voluntary organization, Mahila Arogya Smiti or Mahila, even village health sanitation and nutrition committee, so where NGOs are also there. So as an important member of the health team, you have to conduct meetings with the village working team constituted for each village and with other members of the group of that village. So the details of those meetings you can record in the consultative process register. So in that you can write which month and which year you have done that meeting, date and time holding the meeting, what was the venue, where did you conducted that meet, and the members, how many members attended, and the what all you discussed during the meeting. So all those details you can record in that particular consultative process register. Then referral register is also, the details of the referral cases should be entered in the referral register. As I was telling you that many patients will come to you with different problems, and if you have done something, any intervention you have done or any advice you have given to them or health education given, that you can mention in the remarks, or in case the patient is not in a position to be controlled or handled by you, you refer that case to the higher health facility. That also you can, details of that person you can mention or record clearly in the referral register, and what were the symptoms at the time of referring the patient. So referral register, again, which date patient came to you, name and address of the patient, age, sex, complaints, what were the complaints of the patient, and reason for referral, why did you refer the patient, and where did you refer. That is very important, that you referred the patient to B.Sc maybe, because it is the higher health facility after the sub-center. So because it is important, so that you maintain the continuum of care of that patient, that a patient was referred to B.Sc, and from B.Sc again patient will come for follow-up to you, and at that time you can ask whether patient went to that B.Sc where you had referred, and again patient has come back, so that you can take care and you can do the follow-up of the care of that patient. For maintaining that continuum of care, you can always ask the patient and keep a record with you, that where you refer the patient, and follow-up action taken. As I was telling you, after the patient was referred, patient was diagnosed maybe in the B.Sc, and he comes back to you, report you, and at that time you can write the patient came back after so many days with this diagnosis, with this treatment, and follow-up action you can keep continuing with the patient. Then there are many other reports which are very important from the purpose of from maybe from your village, maybe one or two number of stillbirth or live birth or death is reported, but this is just the data, and once this data of stillborn as well as the other details, they are being compiled at the village level, then at B.Sc level, from B.Sc it goes to the state level, and from the state the data is compiled at national level, then the exact information is derived from this data, so then only policymaker can do their further planning on that data derived from the information which you have provided. So stillbirth report, again, this is, you can ask about the registration unit, village, taluka, tehsil, block, thana, district, town, municipality, date of birth of that stillborn, male or female, place of birth, permanent residential address, father's name, mother's name, etc. These details are important. In case of death report, again you can ask about the date of death, full name of the deceased, place of death, name of the father, husband, age of that person who died, sex, then marital status, whether he was married or not, occupation, religion, nationality, permanent residential address. So these were all the records. Now there is one important aspect that is called the daily diary. As you know, there are so many registers which we have discussed now. Is it possible that you carry all the registers with you and start searching that now I got this eligible couple, so I will take out eligible couple register and record the finding there? So it becomes difficult to take all the registers with you in the community. So you keep a daily diary. So this daily diary is maintained by the health team members. The daily activities are performed in the field as well as in the clinic with regard to the immunization, antenatal checkup, any follow-up, distribution of contraceptives, follow-up of IUDs, identification of pelvic inflammatory disease, respiratory tract infections, birth and death reported, any malaria cases, meetings held, etc. So all these things you can note down in the daily diary, and the meetings, if conducted with the village working team, group of the village representatives, the daily diary will enable to update all the registers to be maintained. So you record all the information in the daily diary, and once you come back to the health center, there whatsoever information you got today in that diary, you will take out that particular register and enter the data in that register. So in that way, daily diary is helpful in the preparation of the monthly report, and it is easy to carry one daily diary instead of all the registers when one goes on the home visit or to conduct the meeting. So any activity you carry out, you record in one particular diary, and later on you can take the data and fill in the particular register which is designated for that particular as per the title of that register. The information which you have carried out, record it in the diary. And if you will not record in the diary, then there are chances that you will forget once you come back to the health center. So it is not easy to remember everything. So once you have write down about the particulars, you can maintain the complete information. Until unless the data collected by you is complete, it will be of no use. So based on that, you prepare the monthly report for the sub-center. So in that monthly report, again you will give the general information about the state in which you belong, where that sub-center is located, under which district it comes, under which PSC it comes, and then come the name of that sub-center where you are working, because in that sub-center, under that sub-center you have taken that village, for that village you are collecting the data. Then population, in case you are compiling the data of 5 sub-centers, then it will come under one PSC, that is primary health center. So population of that sub-center, as I told you, one sub-center caters to near about 1,000 population of in the sub-center. So you'd say in the plain area, or 800 in the hilly area. So what is your location and geographical distribution? Accordingly, you see what population you are catering to in your sub-center. Then reporting for the month of, whether this is the report of January you are going to give, so which month report you are preparing, that month you will write. Then eligible couple, and again you can mention the how many you got, so number of antenatal cases, etc. So you will compile the whole data. Now, as these were the information related to the various aspects which we have discussed. Now the data, this is called the data which you have taken out from the various activities, or the during the survey you have conducted of the households, you have come across so many details. So the data it consists of the observation of the various characteristics or the events that carry little meaning when considered alone, because your 1,000 population is just a data of that 1,000 population. It does not carry much meaning until unless this is converted into or compiled. It has been crisped, and in the form of information it has to be utilized. So data need to be transformed into information. How we transfer the data into information? By reducing it, by summarizing, and by adjusting them for the variations, so that comparison over time and place are possible, as the data consists of the observations of the attributes or the events that carry little meaning when considered alone, but data as collected are inadequate for planning. It has to be reduced, it has to be summarized, it has to be adjusted, and then only this data will be in the form of information. So with this we have covered in this session about the various registers which you are going to maintain at the sub-center level. You need to prepare the map of that sub-center. You need to know the background of that sub-center, where it is located, what all milestones are near about, so that it is easy, what all facilities are available, and if what all resources are available, and you should be familiar with the community. So then only you will get the proper information from the or cooperation from the family members, and then only you will be able to collect the various data from this household under various headings, keeping in mind various register you have to maintain later along with your daily diary. With that, we come to the end of this session. Thank you very much for patience listening. Thank you.
Learned students, now I will give you